Simvastatin is a medication that controls cholesterol, reducing heart attack and stroke risk. This video will break down all the important questions you may have about this medication. Simvastatin belongs to a group of medications known as statins. These medications control blood cholesterol and reduce your risk of heart attacks and strokes. Statins work by reducing the production of LDL cholesterol in the liver. This cholesterol is essential to produce bile in your liver. Because your liver is now not producing cholesterol, your liver sources its cholesterol needs from those in your circulating blood. This action has the net effect to reduce your blood cholesterol levels. Is there anyone who should not take Simvastatin? It's best to speak to your doctor before taking this medication if you have any of the following conditions. You have experienced a prior allergic reaction to Simvastatin or other statins, you suffer from liver disease or have a high alcohol intake, you have hypothyroidism, also known as underactive thyroid, and additionally, individuals with a history of muscle disorders may be at increased risk of side effects. Is Simvastatin safe for use in pregnancy and breastfeeding? Simvastatin is not safe for use in pregnancy. This medication can harm your baby. You must stop this medication at least 3 months before attempting to conceive. If you're planning to get pregnant, discuss this with your doctor early. Additionally, if you're sexually active, you must use effective contraception. Manufacturers of Simvastatin also advise avoiding the use of this medication if you're breastfeeding. What is the correct dose of Simvastatin? Simvastatin doses typically range between 10 mg and 80 mg once a day. The dose prescribed will be dependent on your doctor's reason for starting this medication. It's also quite common for your doctor to review your blood test after at least 4 weeks to optimize your dosing. How should I take my Simvastatin? Simvastatin should be taken once daily, usually at night. You can take this medication with or without food, but always take Simvastatin with a large glass of water. How long will I need to take my medication? Most individuals prescribed Simvastatin will usually continue taking this medication lifelong. Over the long term, keeping blood cholesterol controlled will help reduce the risk for heart attacks and strokes. How long does it take for Simvastatin to work? Simvastatin usually takes about 4 weeks to show the needed improvement in your cholesterol levels. Therefore, your prescribing doctor will usually request a blood test around this time to assess your response to treatment. Most, prior to commencing Simvastatin, will not have experienced any signs or symptoms of high cholesterol. Therefore, you're unlikely to feel any different whilst you're taking this medication. Are there any foods I should avoid? If you're taking Simvastatin, you should avoid grapefruit. This is because grapefruits contain a chemical that interfere with your body's ability to naturally break down the statins. Therefore, grapefruit significantly increases blood levels of Simvastatin and increases your risk of side effects. Can I drink alcohol with this medication? Drinking alcohol alongside your medication is safe, providing you do so in moderation. Drinking alcohol in excess can have a negative effect, increasing your risk of side effects. I've missed my dose, what should I do? If you forget to take your Simvastatin on time, do not worry. Take it as soon as you remember. However, if you only remember the following day, skip the missed dose. Remember to take your next dose at the regular time. Do not take a double dose to make up for a missed one. I've accidentally taken too much medication. Accidentally taking an extra dose of Simvastatin is unlikely to be harmful. However, if you're concerned that you may have taken more than this, it's probably best to consult your doctor. Are there any side effects? Fortunately, most will not experience any side effects. However, as with all medications, side effects can occur. Some common side effects you should discuss with your doctor are headaches, dizziness, sleep disturbance, tiredness or feeling weak, nausea, indigestion, flatulence, constipation or diarrhea, a lowering of your blood platelets, and mild muscle aches. Rarely, people may experience more concerning side effects. The primary concern when taking statins is the development of muscle inflammation and damage. Therefore, if you experience muscle pain, weakness or tenderness, it's important you consult your prescribing doctor. The presence of muscle breakdown can be confirmed with a blood test called CK, where elevated levels indicate muscle damage. In these cases, your doctor will ask you to stop your medication, later considering an alternative or restarting at a lower dose. If you experience any of the following, please consult with your doctor urgently. Altered sensation, inflammation of the liver, where sufferers may experience flu-like symptoms, or inflammation of the pancreas, associated with abdominal pain. Of course, allergic reactions are concerning as they may be life-threatening. Fortunately, life-threatening allergic reactions are rare. Those experiencing serious allergic reactions should call emergency services for assistance. Symptoms of a severe allergic reaction can include swelling of the face, lips, mouth and throat, difficulty breathing, wheezing or chest tightness, and an allergic skin rash. I hope this video has supplied the answers you were looking for. Thank you for watching. We'll see you in the next one. Bye bye.